Republic Act 11223, or the Universal Healthcare Act, was signed in 2019 and it's one of the biggest reforms in our country's health system. The reason why this law was created is because many Filipinos used to struggle when it came to healthcare. Some couldn't afford hospital bills, medicines, or even basic checkups. Through RA 11223, the government recognized that health is not a privilege only for those who can pay, but a right that belongs to every Filipino. So this law or this act makes sure that all Filipinos are automatically covered by PhilHealth, whether you're employed, self-employed, a senior citizen, or even if you don't have a stable income. For those who can't afford to pay, like indigent families, their contributions are shouldered by the government. In short, no one is left out. Another important part of the law is that it does not only focus on hospital care, but also on comprehensive health services. This includes preventive services like vaccines and health education, promotive services like healthy lifestyle programs, curative services like treatment for illnesses, rehabilitative care for recovery, and palliative care for patients with life limiting conditions. By doing this, the UHC Act strengthens the entire health system, from barangay health stations to big hospitals, so that services are more accessible, organized, and affordable.
So next will be your guide questions. So first is how does the UHC Act's goal of an integrated and comprehensive approach necessitate the adoption of a unified health information system? So the RA 11223 or the uh, Universal Health Care Act wants health services in the Philippines to be connected and complete. So, to make this happen, we need a unified health information system. So, like one big computer records that links all health facilities together. S- Um, so, uh, the unified health information systems ensures your continuity, efficiency, and accountability in healthcare delivery, where we need the following, such as your first is integration, which means connection of services. So every Filipino should be connected to a main health provider and a health network. With one system, health data can move smoothly from all your barangay health center to rural health units, hospital, and even big specialty centers. So this stops care from being cut off or repeated. The next is your complete coverage, your comprehensive coverage. So this one needs a reliable data. So your Universal Healthcare Act um, takes care of all the stages of health, simply from your checkups, your vaccinations to treatment, and even long term care. So that means that records about immunizations, your maternal care, your chronic diseases, or emergencies should all be stored in one place. Next is your evidence based decisions. A unified system helps leaders to make better decisions. So, how do we make better decisions? So, with correct data, the government can see diseases that are common and then decide where to put more resources. What department needs more resources, and check if the programs are working. If records are scattered, bulag-bulag ang records, there will be a waste and confusion. So, magkamali-mali na dayon because scattered ang informations. Then, lastly is your patient-centered continuity. It is a unified system that ensures continuity of care. Since all Filipinos are entitled to healthcare services, under your Universal Healthcare Act, their health record must follow them wherever they go. So they should have a solid document or a solid information about them wherever they go. So this avoids repeated tests, wrong diagnosis, or missed medicines. So in short, the Universal Healthcare Act's goal of being integrated and complete can only work if we have a connected health information systems that makes healthcare smoother, more efficient, and more patient-centered. So next is your question number two, which is the RA 11223 mandates the creation of a national health data repository and requires health facilities to maintain an electronic health information system. And what are the specific implications of this for nurses? So basically, the law has direct implications for nurses as frontline implementers of care and a record keeper or your data manager, specifically the following. So your RA 11223 requires health facilities to use electronic health information systems and to submit data to the National Health Data Repository. So this has a big implication for nurses because they are both your caregivers and your data managers. So first is nurses now have expanded documentation duties. So they need to record your assessments, your vital signs, your interventions, and your outcomes digitally. So they don't use the pen and paper anymore, but they use digital record taking. So these records feed into your NHDR. So accuracy and timeliness are very important in this part because um, both patient safety. This is for your both patient safety and your national reports. Second is nurses must develop your health informatics skills. So nurses needs training in your electronic health or your I mean nurses needs training in your EHIS or your electronic health informatics system. So this includes your computer literacy, using electronic health records, your handling of e-prescriptions, and even understanding new coding systems. Informatics is now part of your essential nursing practice. So it is one of the most important practice is as a nurse nowadays. Third is there is a greater accountability for data privacy, especially people nowadays are very knowledgeable of their rights. So, since health data are sensitive, nurses have a legal and ethical responsibility to keep patient information confidential following the Data Privacy Act with liability for mishandling or unauthorized disclosure. Next is your nurses gain a stronger role in care coordination. So, with access to the NHDR, they can follow patients across facilities. So, they are not only limited to bedside care anymore, making sure they get continuous care, proper follow ups, and consistent treatments for the clients they are assigned to. So, nurses are not limited to bedside care anymore, but they are expanded to system based care. Um, then finally is your nurses also contribute to your public health contribution or your public health outcomes. So your nurses are or have their accurate entries on things like immunization, all your records such as your immunization, maternal health, and chronic diseases, support and chronic diseases support disease monitoring. Your so um, this following information supports your disease monitoring, your health policy making, and program planning for the whole country. So, in short, your RA 11223 strengthens the role of nurses not only in bedside care but also in data managing, patient safety, and national health planning. The UHC Act emphasizes the role of primary care providers as the initial point of contact for patients. So how does this provision leverage nursing informatics? The UHC Act strengthens primary care as the foundation of health system, and nursing informatics supports this by electronic health records. Nurses can easily access and update patient information at the first point of contact. For decision support system, informatics tools guide nurses in making accurate assessment, referrals, and follow-ups. For telehealth and digital platforms enable continuous monitoring and patient education even outside the clinic. And lastly, data collection and reporting. Nurses help generate reliable health data that feeds into the National Health Information System, guiding policies and resource allocation. In short, nursing informatics ensure that the patient data is accurate, accessible, and usable at the primary care level, improving continuity of care and decision making. How does the UHC Act, in conjunction with other laws like the Data Privacy Act (RA 10173), regulate the security and privacy of patients' information within the new health information systems? The UHC Act promotes an integrated national health information system where the patient records are shared across the facilities for continuity of care. The Data Privacy Act sets the standards for how this information is protected. First is the confidentiality. Patient data must not be disclosed without consent. Next is the security measures. This use of encryption, access controls, and secure databases. Next is the accountability. Health workers, including nurse, must ensure proper handling of data. And lastly, the patient rights. Patients have the right to access their own records and know how their information is used. Together, these laws make sure that while health information is shared for better care under UHC, it remains secure, confidential, and used only for authorized purposes.
How was the UHC Act spurred a need for changes in nursing education and training in the Philippines? The Universal Health Care Act RA 11223 has created a strong impetus to reform nursing education and training in the Philippines because it shifts the health system priorities and responsibilities in ways that demand new and expanded competence for nurses. For example, the law mandates that all Filipinos be registered with a primary care provider who act as the coordinator of care, thereby emphasizing primary health care, continuity, and systems thinking under Section 3 and 5, the implementation provisions. It also requires CHED, PRC, and DOH to reorient medical and medical professional education toward producing health workers with competencies in the provision of primary care services under Section 24. In practice, this means that nursing curricula must now integrate stronger content in community health, health promotional, health systems management, and informatics. Additionally, the Act's creation of a national health workers support system under Section 24 and the requirement to expand training programs for community based healthcare workers imply that nursing schools must adjust enrollment, offer course offerings, and practical experiences to meet workforce demand, especially underserved areas. Because newly graduated nurses are often viewed as inadequately prepared for community based and systems based roles, there is increasing pressure to upgrade faculty capacity, revise assessment methods, and provide continuous professional development to better align with the UHC goals. In conclusion, the Universal Healthcare Act represents a major milestone in the Philippines health system because it guarantees that every Filipino, regardless of status or income, has the right to quality and affordable health services. For nurses, this law does not only reinforce their role as frontliners in patient care, but also expands their responsibilities in documentation, health informatics, data privacy, and continuity of care. Nurses are now expected to be competent in using electronic health systems, coordinating across multiple levels of care, and contributing to public health data that guide national policies. At the same time, the UHC Act has emphasized the need for nursing education and training to evolve, the integrating stronger foundations in primary health care, disease prevention, community health, health promotion, and digital health. By aligning curricula with the demand of UHC, nursing schools will prepare graduates who are capable not just of clinical bedside care, but also of system based and people centered health delivery. Ultimately, the UHC Act empowers nurses to take a bigger role in ensuring equitable, sustainable, and patient focused healthcare for all Filipinos, making them drivers of the country's healthcare system reform.
So next is your Q&A segment, your question and answer. So first question is, why does the UHC Act require a primary care provider network with patient records accessible across system? Question number two, what are the specific roles of nurses in the National Health Data Repository? Then question number three is, why does RA 11223 emphasize scholarship and training for health workers?
So, why does the UHC Act requires a primary care provider network with patient records accessible across the system? So, the answer is the UHC Act requires a primary care provider network with accessible patient records because it first ensures continuity of care by making health history available anywhere. Second is it reduces duplications of tests and procedures, saving time and resources. It prevents medical errors through accurate updated records. And it improves coordination between different levels of care. And lastly, it supports better health outcomes and patient safety.
Question number two. What are the specific roles of nurses in the National Health Data Repository? Answer: nurses play an important role in the National Health Data Repository by ensuring accurate documentation of patient information, validating data quality, and safeguarding confidentiality in compliance with privacy laws. They contribute to reporting key health indicators, collaborate with other health professionals to standardize records, and use data to improve patient care and community health programs. Through these rules, nurses help ensure that health data is reliable, secure, and beneficial for better healthcare services.
So question number three is, why does RA 11223 emphasize scholarship and training for health workers? So your RA 11223 also focuses on strengthening the health workforce. So first, it aims to increase the number of skilled health professionals to address shortages in the workforce. Second, it works to promote equity in healthcare by making sure that even underserved and GIDA or geographically isolated and disadvantaged areas have access to competent providers. Then third is um, the law supports continuous professional development so health workers remain updated with new knowledge, technologies, and standards of care. So it not only helps our country, but it also helps ourselves or it helps the people of the country. And lastly, it seeks to strengthen the overall health system by distributing well trained professionals across all levels of care, helping to reduce the gap between urban and rural areas. So, in short, your RA 11223 ensures that we have enough skilled, fairly distributed, and continuously trained health workers to serve all Filipinos.
So before we end our report, I want to leave you with some discussion questions to make us think more critically about the Universal Healthcare Act. I'll ask a few simple questions and feel free to share your thoughts. Number 1, how can joining city and province health systems together make healthcare stronger? Number 2, what risks do you see in shifting to electronic health information systems, especially in rural areas? Number 3, in your opinion, how can the UHC Act's emphasis on affordability and equity be realistically achieved in both government and private hospitals? To sum it up, the Universal Healthcare Act is about three big things: population coverage, service coverage, and financial coverage. This law is designed to make sure that healthcare in the Philippines is truly universal, equitable, and sustainable. That is all for our report. Thank you guys for watching.